Okay, so we speak to a lot of people from outside of industry, like nurses or allied health professionals interested in a career move into medtech. What positions in your team would be relevant for somebody like this?
Yeah, good question. I think Innovate are one of the leaders in this area, and you're making this sort of industry available to a lot of people. So that's well done to you guys. From our side, I think someone coming into the industry that doesn't have experience, a great pathway is to go into a clinical specialist role first. Gives you the opportunity to learn and get an understanding of the industry, get an understanding of the environment, the surgeons, the nurses, hospital management, and build a foundation of knowledge and relationships that you can build upon. And then as you become more confident, you've got the opportunity maybe to take on more commercial responsibility through a associate sales role or potentially a territory manager role.
Okay, so what traits do you think make someone successful in your team?
I think someone who's highly motivated and has the ability to work autonomously is two big traits that we really look for. One thing with, I guess, medical device sales is every week can be different, every day can be different. So having the ability to navigate that and still develop your knowledge, have the discipline to commit to your education, have an active interest in what you're selling and what you're supporting is very important. So we look for people that are focused, driven, and wanting to develop. The other part of it is communication skills. I think the good people in the industry are able to navigate different relationships, and that can be from a CSSD manager to a surgeon to a hospital executive, and having the ability to build rapport quickly and add value and be a resource, whatever environment you're in, is very important, and that's what we look for.
Excellent, thank you. That really helps to explain. Gareth, what does a day in the life of a clinical support or associate territory manager look like in your team?
Sure. I'll start with the clinical support roles. Typically, they're in theatre most of the time or in hospitals. So most probably, 3 to 4 days a week would be either in theatre or in the hospital. Obviously checking equipment, so they're checking implants and instruments, ensuring that the right equipment is there for the right patient. There would be technical support in theatre. So typically when a Medacta product is used in theatre, you are in theatre providing technical support to the nursing staff, answering questions of any surgeons that they may have throughout the procedure. And then in the days that you're not in theatre, you'll be looking at administrative type work where you are putting in bookings, you are checking equipment that's been sent out from the warehouse, you are providing education to nursing staff or hospital staff around those procedures. So it can vary quite a lot. There can be long days, and there can be shorter days, and I think having the ability to be able to manage that is really important if you're thinking of entering this role. If you are a 9-to-5 type person, this most probably would be a challenging industry to work in for you.
Yeah, completely agreed. No 2 days are the same, and you can't really plan for the changes, can you?
So true.
It's good to know that. Thank you.
An associate territory manager, they're responsible for both technical support but also developing the business as well, or growing the business. So every week can be a bit of a mix, and it would depend on how many cases your surgeons have scheduled and how many sales calls you have planned with potential targets. So there's two aspects to the role. There's managing the current business and then growing the business through the various means and tools that you have available to you.
Excellent. So it's almost like a training pathway towards the territory management position.
Absolutely, yeah, that's right. So an associate territory manager will have most probably a smaller territory, a smaller number of surgeons to look after, a smaller number of surgeons to target, but it also has less commercial expectation as well. So you have the opportunity to develop along that pathway into a territory manager's role without having too much pressure on your back in terms of chasing a number.
Excellent, thank you. Okay, so Gareth, there's a lot of experience in your team nationally. How do you and the team support people making this career transition?
So for someone joining the industry, we've got quite a well-rounded education program. We've got what we call My Orientation, which is a 6-month 6-module training program where people can work through submitting expenses through to understanding kinematic alignment or medial stabilised knees and why they're such a good match for patients wanting to regain function. So at each stage along there, our managers are able to instruct, teach, coach, and also check someone's knowledge level and check they're comfortable talking about those topics in theatre. The other thing we have is the new hire training, and we run that 3 to 4 times a year. That's a 3-day intensive module where we cover all things Medacta, and the marketing team support that, and it is quite well rounded. It gives people a good understanding of what the industry is about, who the competitors are, and what is unique about what Medacta do in the market. So we like to support people along the whole way.
Great, thank you. So Gareth, if somebody did join your team as a clinical support, how could they develop their career over time?
Yeah, I think we've seen this a number of times at Medacta where people have come into Medacta in a role, and that's not where they're working right now. And we've got a lot of clinicals that have joined the company, people that have come from outside the industry, and they've worked along a pathway. So typically from a sales point of view, the pathway would be a clinical support role or a clinical support representative, and from there you would move to associate territory manager, where you can take on a little bit more commercial responsibility. You would take responsibility for 1 or 2 clients maybe, and have a small number of surgeons that you would be targeting to try and convert their business. From there you would move to a territory manager's role, and in that role you're taking full commercial responsibility. So you're not only responsible for a large portion of business that comes through Medacta, but also targeting and growing that business, and must be a bit more expectation. Our job is to try and support people through that pathway, and from what I've seen in the industry, I think doing it in a stepwise fashion is wise. It does take some of the pressure off, and you do learn a lot through those first 2 to 3 years. So it's important not to jump too early before you're ready, because it can put a lot more pressure on you. So I've seen a number of people at Medacta that have taken this pathway and taken it in a stepwise fashion, and they're achieving great results and adding a lot of value to the company. It's great to see.
It really sounds like you're setting people up for success along that career pathway. So thank you for sharing that.
Yeah.